had like a whole thing in my head and I totally forgot about it. So a little bit about my warfarin experience. When I've been in the industry for about, since I was 16, so about 11 years now, 27, so old lady, kind of. So when I first started in emergency medicine a few years ago, one of my first patients was a dog that came in for hemorrhagic bleeding from hemorrhagic gastroenteritis, what we call HGE in vet med. What that essentially is you can kind of guess an animal is bleeding out from their other end. This dog also started bleeding out from the nose, and we're like, what is happening? The owner insisted dog didn't need anything. We later found out that the dog had been roaming around the yard. The neighbor uses rodenticides to keep control of their rat population, and it ended up being warfarin. So we went ahead and tested the animal for its clotting time, and lo and behold, no clotting time. So warfarin, rodenticide or humanicide, what exactly does that mean? We are going to be looking through that, figuring that all out. A little bit about the history of warfarin. So back in the 1920s, if you guys remember, that was around the Great Depression era. Farmers were coming out to their cows, also bleeding out. They didn't really know what was going on. They considered it a mysterious bleeding disease. A veterinary pathologist by the name of Dr. Schofield ended up finding relatively the cause of the bleeding. He determined that it was from the moldy clover hay that the farmers were feeding. They were feeding moldy clover hay to kind of limit the cost of having to pay for the hay. And if you guys are familiar with hay costs at all, it's always obscenely high. So what he did is he took rabbits to experiment with, feeding them both moldy hay, moldy clover hay and non-moldy clover hay. And lo and behold, the rabbits that ate the moldy clover hay were dying from hemorrhagic gastroenteritis. The exact reason why moldy clover hay was destroying these animals from the inside out really wasn't figured out for another 10, 15 years or so until a scientist by the name of Dr. Carl Link determined and isolated the agent. Who here likes the smell of freshly cut grass? It's a great smell, yeah? Yeah, it's a great smell. That is actually from coumarin, which was from the moldy clover hay. Fresh cut grass smell can kill you. Not really. But how it happens is the fungi, there's a couple different ones that interact with these forages, end up creating coumarin in the hay, which was then isolated into dicumarol, which was later synthesized into warfarin, which was recovered by Harold Campbell, one of Dr. Carl Link's understudies. A little bit of a timeline of warfarin. So Dr. Carl Link, I obviously created this warfarin, isolated the dicumarol, all that jazz. So he's like, well, I'm gonna make a little bit of money here. So he commercialized it as a rodenticide. Rodenticide meaning it kills rodents. A man in 1951, he was a US Army inductee. He really didn't want to go into World War II. So he attempted suicide with warfarin, unsuccessfully, thankfully, for him and his family. They recovered him with vitamin K. What is it about vitamin K that recovered him? So we'll go through that as well. Because of this incident, warfarin was further tested and approved for medical use. They discovered that warfarin, obviously it has that anticoagulation effect, so they discovered a way to use that for our benefit, not so much the rodents to mice. President Eisenhower was one of our first patients using warfarin because he had a heart attack, and so that kind of helped him there. A little bit about the warfarin structure. In nature, it is an odorless and tasteless crystalline structure. It is comprised of carbon benzyne rings and a couple alcohol structures there. A little bit further into the structure of it, we have our VSEPR structure. So we have our carbons, which are going to be the grays, oxygen, which are the reds, and hydrogen, which are the whites. The molecule itself is comprised of polar and nonpolar bonds, meaning polar is kind of like a battery. You have your negative end, your positive end. Non-polar meaning it all cancels out. A little bit about the solubility. So warfarin is an amphipathic molecule. Amphipathic, again, it's a polar and non-polar, has not polar and non-polar bonds. Polar bonds are hydrophilic, meaning that it likes water. And a couple of the hydrophobic non-polar bonds there, meaning it does not like water. A great analogy for this is oil and water. It is, despite being polar and non-polar bonding, is a small non-polar molecule. It also is lipid soluble, meaning that it is fat soluble. Fat soluble molecules are readily absorbed through cell membranes. So therefore it has a rapid absorption into the body when taken through the GI orally. Again, a little bit more about that. So rapid absorption, when we are taking it as an oral anticoagulant, it does have a delayed onset. So sometimes when patients are first starting on the medication, they don't really feel its effects. They're not really thinking it's working. Hopefully they don't take additional warfarin to compensate for that, because that will have very terrible effects. It does have a very long half-life of 40 hours, which in medicine is pretty long. And it's a very stable molecule, even when introduced with strong acids. However, despite having its great effects in medicine, it is also extremely toxic. 33% of all hospitalizations due to drug toxicity are from warfarin. It has a very low therapeutic range, and it's one of the top 10 drugs treated for toxicity, and actually the second one usually seen. As far as the toxicity, a running joke with it is, first off, who here likes to sleep in bed all day? Not have to get up? Yeah. Well, if you're a warfarin user, that's essentially what all you can do. The running joke with warfarin is, what can I do? You can't really change your diet. You got to be careful with your exercise. You have to keep everything consistent due to its low therapeutic range. It is a teratogenic toxicity, meaning that it crosses the placenta and it affects the developing organs of the fetus. Therefore, we have our reproductive defects there. It affects the kidney and liver, therefore it can damage them. Dermal toxicity, again, it's lipid soluble, so it's easily crossing our cell membranes in our skin, creating a toxicity there. Inhalation, obviously hemorrhagic effects. Kind of feel like that's kind of silly, but and then it also can cross the blood-brain barrier. When that occurs, it can cause bleeding in the brain, which can lead to a stroke. A little bit more about how vitamin K saved that man in 1951, the U.S. Army inductee. So if we look here at vitamin K and warfarin, well, if you're not familiar with chemistry, it may just look like a bunch of lines. But a little bit of color coding here shows us how structurally similar these two molecules are. Though warfarin is labeled as a vitamin K antagonist, what that generally means is that it will destroy the molecule that it's antagonizing, whereas warfarin actually just prevents it from recycling. Vitamin K is a molecule that recycles itself multiple times before it's excreted from the body. The best analogy for this is a little bit of a lock and a key, and our stick here, wonderful stick. So hopefully no one's ever had to try to break into their house before locking themselves out. I'm not going to say I've done that a few times. So right here, the key would be the vitamin K that's trying to reproduce our vitamin K oxide there, and our door there is the VKOR, our recycling agent, or enzyme rather. Our stick is going to be warfarin. So basically, during the process of recycling, warfarin will go in, it'll put itself into our doorknob, preventing vitamin K from being able to be recycled. Another reason that vitamin K is so important, it is metabolized in the liver, produced in the liver, and so on and so forth. It is a blood clotting vitamin. So we can see where warfarin and vitamin K are very similar as far as like why they would interact with each other. So if vitamin K did try to, you know, jumble out warfarin from its little buddy here, our doorknob, if it were to be broken off, the stick would probably break off as well if we're trying to break open a lock. So it's never going to be able to get back into our VKOR. Both of them do have molecular similarities or chemical similarities, being lipids soluble, metabolized in the liver, excreted similarly through urine and such. Obviously, we saw the structural similarities. The reason that warfarin has an onset delay is because of the recycling process. It takes some time for that to occur. It takes some time for the body to absorb the process there. So the onset delay is about, I believe, 8 hours, which is pretty long in medicine. Most, you know, medicines we feel maybe instantly or at least within the hour, which also goes into its half-life. Again, we kind of went over the therapeutic range being very small. When you are a patient on warfarin, you are constantly getting tested. You have to test to make sure that you're always in that therapeutic range. If you're below that therapeutic range, you have a clotting risk. So embolism is a huge thing here. And from what I've gathered from a wonderful source, when he was in cardiology, they would constantly test the therapeutic levels, and usually patients are actually under instead of over. Over is extremely bad because that means you're not going to have any clotting and you have to basically live in a bubble. So that's about warfarin.